Good afternoon. I'm Tamisha Harini and I'm a physical therapy student from the University of Colombo. Today I'm presenting our study, the prevalence of post-stroke depression, its relationship with the functional ability and some selected associated factors among stroke survivors in Sri Lanka during early rehabilitation. So post-stroke depression or PSD is the commonest psychiatric complication that occurs following a stroke. Although the consensus is that approximately 1/3 of the stroke survivors develop PSD, a wide variations in the prevalence is reported in the literature. The variability between the results of these studies depend on the assessment and diagnosis of depression as well as the population they studied. Post-stroke depression has a significant negative impact on rehabilitation. Therefore, identifying PSD prevalence and its associated factors during the initial rehabilitation promotes early detection and treatment of PSD, which will lead to positive outcomes in post-stroke rehabilitation. The specific objectives of our research are to identify the prevalence of post-stroke depression in patients with stroke during the initial 6 months of rehabilitation, to find out whether there is an association between the severity of depression and the functional ability, and to identify the associated factors for PSD. So we carried out a cross-sectional descriptive study at the Rheumatology and Rehabilitation Hospital Ragama, and the patients who have a diagnosis of a stroke with a post-stroke duration of maximum 6 months attending the rehabilitation program at Department of Physiotherapy were selected as the study population. Data were collected from 70 participants through a consecutive sampling method by using culturally validated self-administered questionnaires. They are the Patient Health Questionnaire 9 to diagnose depression and the Lawton Instrumental Activities of Daily Living Scale to measure the functionality. A semi-structured questionnaire was also given to collect the demographic data, and the data were analyzed by SPSS version 23 software. Results. Characteristics of the sample. So out of the 70 participants, 39 were male and 31 were female, and participants of ages between 33 to 79 years from Gampaha, Colombo and Monragal district participated in this study. Prevalence of post-stroke depression. The PHQ-9 scores for depression in the study sample ranged from 0 to 17 with a mean PHQ-9 score of 7.16. 74.3% showed any form of depression in the study sample, and 45.7% were mildly depressed. Functional ability and the post-stroke depression. The IADL scores for functionality level range from 0 to 8 with mean value of 3.41, and a negative correlation between the functional ability and post-stroke depression was identified with the Pearson's correlation test. In our study, age, gender, ethnicity, marital status, employment status before the stroke, educational status, involvement of the dominant side, and previous stroke were evaluated as possible associated factors for PSD. Only female gender, employment status before the stroke, involvement of the dominant side, and previous history of stroke were identified as having significant association to the PSD. This study reports a 74.3% of high prevalence rate among stroke survivors attending early rehabilitation. The overall prevalence of PSD is relatively high compared to the pooled evidences in the systematic reviews. However, only 28.6% had major depressive symptoms that are in concordance with similar previous study findings. The negative correlation between the functional ability and post-stroke depression was consistent with most previous study findings. female gender, involvement of the dominant side, history of previous stroke were common associated factors observed globally, which was confirmed in our study. Limitations. So, the smaller sample size is one of the main limitations in our study, as fewer patients participated in this study due to the COVID-19 pandemic. And the patients were screened primarily to detect the PSD symptoms. However, a further psychiatric evaluation is needed to confirm the diagnosis. The ethnic diversity of the participants failed to represent a Sri Lankan population, as the majority of the participants were from Western Province. So, in conclusion, post-stroke depression is more common among stroke survivors, as 74.3% of the patients undergoing stroke rehabilitation develop PSD, and the prevalence of depression is almost threefold higher in this sample, while the majority of the patients go unnoticed with mild depressive symptoms. Post-stroke depression should be detected early and treated promptly for better prognosis and positive rehabilitation outcomes. Thank you.